In today's video, I'll be talking about a severe and chronic mental illness which is known to be schizophrenia. So what is schizophrenia? Schizophrenia is a severe and chronic mental illness which is present in almost 20 million people worldwide. So when we talk about schizophrenia, so it's not simply a disease, it's a syndrome. And what do we understand by syndrome? Syndrome means the group of diseases. So schizophrenia is not comprised of certain kind of symptoms. It's comprised of various kind of symptoms that involve positive symptoms, negative symptoms and cognitive symptoms. So what are these positive symptoms? The positive symptoms are comprised of hallucination and delusion. I'll be giving a detailed explanation later. Then comes the negative symptoms. Negative symptoms is comprised of like the person will have lack of emotions, apathy and difficulties in talking and disorganized behavior, etc. Then comes the cognitive symptoms. And cognitive symptoms are comprised of means a person will have lack of concentration, difficulty in learning, and the person will have difficulty in speech. All these are the cognitive symptoms that are present in a schizophrenic patient. So the schizophrenia is comprised of three types of symptoms, that are positive symptoms, negative symptoms and cognitive symptoms. Now let's talk about the etiology. The etiology of schizophrenia is not yet known. The exact cause is not yet known, but the causes that are means believed to be causing schizophrenia, maybe the changes in the brain chemicals, that are the neurotransmitters, serotonin and dopamine levels. And if the person has family history of schizophrenia, then also the person can develop it. If genetics is involved, like there's a problem in genes, then this can also be the reason. If in a family the parents has this condition, this illness, then there are chances that the children will have it too, and the siblings can also have that. So these were the causes that are considered to be causing schizophrenia. Then comes the symptoms. So as I've already told that there are three kind of symptoms that are present in a schizophrenic patient. First is the positive symptoms, that is comprised of hallucination and delusion. So what is hallucination? The person will see or hear things that are not present in the real. In reality, those things are not present, but the person will be able to see them, and the person will hear those sounds which are not present in reality. Okay? So this is about the hallucination. Now comes delusion. Delusion means फिक्स्ड फॉल्स बिलीव्स, मतलब ऐसी चीज़ों को मानना जो कि एक्चुअल में है ही नहीं. सो दैट इज delusion. So in a schizophrenic patient, there are two kinds of delusions that are seen. First is delusion of reference. And of reference means the person will think that everyone surrounding him, like his family members, his friends, even the unknown persons who are just walking on the road or sitting beside him, he'll think that everyone is planning against him, everyone is making a strategy to hurt him or to kill him. So this is the delusion of reference. मतलब इंसान को ऐसा लगता है कि हर कोई उसी के बारे में बात कर रहा है, उसे हर्ट करने के लिए प्लान कर रहा है, कोई ऐसी स्ट्रेटजीज बना रहा है जिससे कि वो उस इंसान को हर्ट कर सके, उसे हार्म कर सके. सो दिस इज व्हाट वी कॉल delusion of reference. Next comes delusion of persecution. So what is delusion of persecution? It means that the person thinks that somebody will try to kill him, that अगर उसके घर पर भी कोई आ रहा है तो उसे ऐसा लगेगा कि वो उसे हर्ट करने, उसे मारने के लिए आ रहा है. So that is the delusion of persecution. So these are the positive symptoms that are seen in a schizophrenic patient. Now comes the negative symptoms. So the negative symptoms are comprised of like the person will have lack of emotions, the person will have apathy, person will have difficulty in talking, the person will be unable to maintain a proper hygiene, there will be the poor hygiene, okay, of the person. Then comes the cognitive symptoms. So the cognitive symptoms are comprised of like the person will have difficulty in concentration, difficulty in learning and difficulty in speech. So these are the cognitive symptoms that are present. Schizophrenia is also stigmatized like every other mental illness. So instead of making it a stigma, the persons who are suffering with the schizophrenia, they should be treated like normal human beings and they should be given a proper treatment, then only they can recover. So the treatment of schizophrenia is comprised of the following. First is the antipsychotic drugs which are given in order to treat the hallucination and delusions. Next comes the psychosocial treatment. So psychosocial treatment is comprised of cognitive behavioral therapy. Now what is cognitive behavioral therapy? Cognitive behavioral therapy is a psychotherapeutic treatment which is given to the patients suffering with the mental illnesses. It's a kind of therapy which is aimed in changing the behavior of a particular person which is suffering with a kind of mental illness. Like इसमें cognitive behavioral therapy, the psychologist will tell the person suffering with this kind of mental illnesses how his negative thoughts are having adverse effect on his or her life as well as the life of his family members, and how this is impacting his friendships, his social relationships, how this mental illness and his negative thoughts are disrupting and creating disturbances in his or her life. So these are the things that are being told by the psychologist, and the psychologist tries to change the negative thoughts of the person, okay, by counseling him. So this comes in the cognitive behavioral therapy. Now this was about the definition and the causes and the treatment related to schizophrenia. Now one thing more, I would like to add the types of schizophrenia to this. So what are the types of schizophrenia? So first is the paranoid schizophrenia. So the paranoid schizophrenia is the most common type of schizophrenia that is found. It is comprised of hallucination and delusion. So the person with paranoid schizophrenia will have hallucination as well as delusions. Next comes the habiphrenic schizophrenia. So in habiphrenic schizophrenia, the person suffering with this will have short-lasting hallucination and delusion plus disorganized behavior and thoughts. Next comes the catatonic schizophrenia. So what is catatonic schizophrenia? It will have the mixture of the symptoms of the habiphrenic schizophrenia as well as the paranoid schizophrenia. इसका mixture होता है इसमें. Next comes the simple schizophrenia. So in simple schizophrenia, the person will have negative symptoms like poor hygiene and lack of emotions, apathy, difficulties in talking. So these are the negative symptoms that are present in a person suffering with simple schizophrenia. Now next comes the undifferentiated schizophrenia. So what is the undifferentiated schizophrenia? In undifferentiated one, the person will have the symptoms related to schizophrenia, but they cannot be classified either in the catatonic, habiphrenic or paranoid one. So these were the common types of schizophrenia that are being present in people. So that was all for today. Thank you.